Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For our education episode this week, we are going to go throwback to our fun time at the Memorial Hermann Sports Medicine Update.
So we did a series of podcasts thanks to Sports Medicine Broadcast, who helped us host over there in Texas. But this is our first one that we are releasing. We did them all live, but this is the first one that we were releasing on our podcast. So It's really exciting.
And no better to be the first one from that conference than our interview with the two dentists that presented there.
And they're also married.
Yes, that's right.
Isn't that really cool?
It was very ironic.
It's very fitting.
Yes, very fitting for us.
So we talked about a lot of topics, including starting a relationship with a team dentist, what to do with certain tooth injuries, what resources are available. They talk about this really, really cool app that I downloaded and actually have gone through a little bit, and it's something that you want to have on the sideline. They talked about mouthguards and kind of the different types, how you can get a personalized one or the boil and bite ones, the differences between those, dentists within PPEs. Mm-hmm. We talked about stories. We went over so much, and it's within 30 minutes?
Yes. Yeah. A lot of information packed in a very short time. So it was perfect.
Yes. So do you have anything else?
Yeah, I was just going to say I think this is a great follow-up for the position statement on dental injuries, because now we actually get to hear from the dental professionals on
the actual experts on this topic.
Yeah, and kind of what their game plan is.
So without further ado, let's listen to Doctors Reagan and Matthew Hiner.
All right, here we go in 3, 2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast, Dental Issues in Sports with Reagan and Matthew Hiner. We are at the Sports Medicine Update 2023 here in Katy, Texas, joined by my podcasting friends, Randy and Sandy Harris. They came all the way in from California from the A2 Corner podcast to talk with Doctors Hiner or Dr. Heiners? Be Hiner. Doctors Hiner.
Doctors Hiner, I think.
It's up to you.
Yeah.
I think anyone
Doctors
works. We know what you're saying.
So just recently, I was kind of making plans to go to the Academy for Sports Dentistry conference is in Nashville this summer.
Yeah,
it didn't really work out, but I think they're going to try and have you come out and do the podcast there, because it's such a good issue for athletic trainers, because this year alone, I think I've had 2 or 3 basketball players get their different teeth knocked out.
Yeah.
And it's just okay, what do we do? All right, cool. Yeah. And it's always we got to send them, because I don't know if it's coming out. I don't know. You just need to go and get it checked by
definitely
an expert. And so this is a really cool issue. I know Randy has taken notes, so Randy's going to do an interview. But welcome to the Sports Medicine Broadcast.
Yeah, thanks for having us.
Thank you so much, Jeremy. That brings up a good point, because most of the time when you think of a team dentist, it almost becomes a afterthought until you need one.
Yeah.
And then you're like,
sure.
I wish we had that lined
definitely.
up for us. So kind of going on those lines, how do you go about starting that relationship to find a team dentist?
Yeah, I mean, that's a good question. So I think, at least from our perspective, I think we kind of, at least maybe we're just young and adventurous, but we kind of go out and look and find, because we've found that there is definitely a deficit in teams where you kind of ask, you can call a school. Usually the athletic trainers are, kind of the ones that are points of contact. So we found a lot of athletic trainers don't have somebody. So we kind of have been active in that and trying to find and be like, hey, we can help you out and do that. But I think from the athletic trainer perspective, you want to find somebody who is available and able to come after hours. I think that's really important. You have to find someone that actually, loves it. I think there's, and it can start as even as simple as cold calling dental offices in the area. You want to be somewhere close. Like we talked about, we'll probably get to, a lot of things are time dependent. So you don't want to have a dentist that is a good friend, but he's, his office is an hour away or something. So I think that's important. And but as far as establishing that relationship, do you have anything to add as far as what to look for? The only thing I think of is, cold calling and or Google searching, obviously, would be something, typing in sports dentistry, because a lot of people will advertise that on their website. Okay. So that may pull up, with on the SEO terms and things like that, it may pop something up. But
it's also, it feels like it's a pretty small network of people as with the trainers, and everyone seems to kind of know each other, especially if there's, the big hospital around, like here in Houston, there's a few big ones that kind of cover a lot of the high schools around you. So I think if you even can ask a trainer if they know someone, because usually somewhere in the mix, they would have met a dentist who is one for another high school or another team, or maybe just does mouth guards for someone. So that might be somewhere to start too, especially if you don't, or if cold calling.
Definitely, and I think
kind of hard sometimes.
We do have the advantage of being in Houston, one of the largest medical center, a huge medical population. So, but I think to help people that are in more rural areas, I think it's important. You're a lot more limited on options, but also I think the dentists kind of know that comes with the territory. If you're in a rural area, you kind of know that you're going to at least have to be that front man or woman for that kind of stuff. So may make it actually a little bit easier if you are in a more rural area because you don't have as many options. So that's something to consider too.
And all dentists, we know it's very rare. So it's not a huge commitment to really, do anything at all.
Yeah.
Okay.
We gave out our numbers to a bunch of people today, and don't feel bad at all because it's so uncommon. So we'd be happy to help anyone.
Yeah, definitely.
It rarely ever happens.
Yeah, I found that a lot of people feel bad, calling, but it's really, it's a great opportunity. I think if you find the right people that are able to, wake up and do that, or, in the middle of the night, or, hopefully not in the middle of the night, but are able to go after hours and treat you. I think it I don't know, at least personally, I think I like that part of it, but it's not something that where it's like you're going to bother them. I mean, most of the time it's kind of like, we can help you out with that. And if you find somebody that likes to make mouthpieces, all that, it doesn't really feel like you're really adding that much more work by taking on a team or an athlete.
I mean, it's like they say, if you love what you do,
you
don't work a day.
Yeah, exactly. Yep. That's so true.
Along those lines, as far as like those after hours, especially with like athletics, right, where we're usually in the evenings or like some oddball hours or holidays, what are the resources available for the athletic trainer to, hey, I have a dental emergency kind of thing. Where do I turn to?
Yeah, I think so. Like for the resources, I think it kind of starts with, you mean like how to get in contact with the dentist, or like
Possibly,
resources?
Yeah,
I think it starts with this, at least for me and for us, it starts with the cell phone number. That's the biggest point of contact. A lot of people, we have our office number, of course, and we get those voicemails and text messages and things sent to our phones after hours. So we can keep up with that. But the fastest way is just to text or call. I think that's the biggest resource is just having the actual cell phone number of the dentist. And I think that would kind of be like on your search, you'd want to find someone that is available to give that to you. If they're kind of like, just call the office, then it's going to be, they may not, if it happens at 8 at night or something like that in a game, it may not follow that train of like, you may just kind of get no response back, which is not what you want to have, especially in an urgent situation.
And then something available for anyone, especially if you aren't, if you don't have a dentist, is we just talked about the Tooth SOS app, and I'm not sure if everyone has. It's a free app, and you just download it. Yeah. You say you're not a dental professional, and then you say what happened, and then it kind of walks you through what to do. Now, it won't connect you to a dentist, so you still have to know a dentist if it is truly an urgent thing. But some things you can see the dentist the next day, which is easy. You call anyone during open hours, and you can get in. It's more the emergencies that are kind of leave you looking for someone.
Got it.
Definitely.
And how, as far as that referral process, there are a lot of different dental professionals as far as like, you have your general dentist, your orthodontist, and then the maxillofacial surgeons. What's a good way, like how do you know how to or who to refer to for certain situations?
Yeah, that's a great question. I think for the majority of injuries that you're going to see start with the general dentist. We had that question earlier about like, if they have braces, do you go straight to the orthodontist? And that's a very valid question as far as like who to turn to. I think the best and simple answer is find a general dentist. Okay. Because there's not there's different things like fellowship and traumatology for dentistry and things like that, but those are all general dentists mainly. So that would be my place to start. And the good thing is that's going to be the most abundant position too. There are a lot more general dentists than there are specialists. So simple answer, start with the general dentist for trauma. And then the general dentist will be the one to tell you, hey, they need to see their orthodontist after we fix this, or they need to, if it's something severe, then that kind of is when it turns over to oral maxillofacial surgery, because everyone has their own level of like what they treat. But for the most part, if you go to an oral surgeon and you're like, I got a chipped tooth, I need a filling, they're going to be like, we don't even have that stuff here. Like we don't do that. They'll say it nicer than that, obviously, but they'll point you back to the general. So I think start with general and then we'll refer you where you need to go from there.
That brought up a good point about as far as braces go. Are there any special considerations that the athletic trainer should keep in mind when having an athlete with braces, whether that's preventing a dental injury or even, okay, now we have the injury, how does the braces complicate that?
So I just have a PSA. I wanted to say it earlier up there, but we kind of ran out of time. But if you have braces, you have teeth in active movement, and the ligaments are already widened, so you're actually more likely to have dental trauma, like big dental trauma to the bone, if you're in braces. So it is extra important, especially these young kids. They don't really want to wear mouth guards. Try to convince them wear a mouth guard. And there are some really good ones that do kind of latch over braces and kind of give them a good fit. That aren't actually they're not very tight, so they kind of fit over any braces.
And
that
that's
way they don't
another
have
thing
to change them all the time.
Yeah, sorry to interrupt. The thing to consider is the teeth are going to be moving the whole time through Invisalign or braces. So if you have a custom fit mouth guard, which we can make for people with braces or Invisalign, but you have to keep in mind that that's going to have to be replaced as the teeth move. They're not wearing their mouth guard 24 hours a day or anything, so it's not going to super effective. But if you start at the beginning of treatment and then even like a month down the road, the teeth are going to be a lot in different positions depending on the treatment plan and everything. So that mouth guard needs to be updated to fit over the braces. And as Reagan said, there are mouth guards that are made for braces that are a little bit not looser, but just more. They're not as adapted to the dentition of the teeth as the custom ones are. So that's another thing to consider, that the teeth are going to be moving, so the mouth guards won't fit.
Yeah, and a custom mouthpiece. We all dentists love custom mouthpieces. We get to make them. They look nice. They fit very nicely. They're more comfortable, and you can talk better. But like we said, it's hard to do that over braces, especially if you're in the middle school, high school age, and they're already it's hard to get them into an office anyway. But what was my point? Oh yes, the ones that are fit by a dentist versus the ones that are over the counter, just the boil and bites, they'll both protect your teeth perfectly fine. The big reason dentists like the custom ones is because there's more compliance. So a player will be more likely to wear the
they'll
custom
stay in
one.
when you're talking. There's a lot of communication that goes on during a game or practice in pretty much every sport. So it helps to be able to talk without it falling down, and that definitely will increase compliance among athletes.
But for braces, just have them wear the ones that are all braces, kind of an over-the-counter one.
Okay, perfect. Yeah, because I was going to say, I feel like a brace or a mouth guard that can go over braces, that'd be awesome. Because
it has a little ledge. It's nice.
That's really dope.
Yeah. I mean, I think we've had a lot of players that have been in Invisalign. That's a lot more common now, which is a little bit easier. But you can still adapt the custom mouthpiece around that. But it does need to be updated more. But if you have somebody that can stay on top of it, it doesn't take long to get a scan or an impression to update it. And I think that's it's not going to do enough to change. They're not wearing it long enough to actually change the teeth, to revert back to how they were before, to delay treatment or anything.
For that mouth guard for the braces, from patients that you've talked to, how have they felt about it? Because when I had braces, I know anything around it, I'd be like, man, that just feels weird.
Well, I don't think many, especially that age, will like any mouth guard. So it's a tough sell, and we're always kind of trying to battle that, but. It still fits pretty nicely. So whether or not they like it, they probably won't like it still. Okay. Whether it's one for the braces or one for just anyone that kind of is really loose over the braces, just because they want to talk. It's hard. But yeah.
I was just gonna add too, about with the braces on, you're a lot. With trauma, it's kind of like you have all those metal spikes in your mouth. You're going to see a lot more soft tissue injuries, like with lips and things and complications. So that would increase their risk of needing, sutures or things like that. If you always want to check the inside of the lips, because if you get hit in the face, then the underside of your lip basically is going to be what's going to take that blow of all the metal. So,
okay. Yeah, that's not a fun time.
No, definitely not.
I've definitely had some basketball guys, even just the minor, they have braces, refuses to wear a mouth guard. Yeah. And constantly getting his lip cut. And I'm like, at least put some Vaseline or something on it.
They make that wax, but I don't know how that seems more annoying. I remember I had that whenever I had my braces.
Going back to the referral process, as athletic trainers, we're usually pretty comfortable helping with that referral process for our athletes. So making sure the appointment's set up, making sure the provider they're seeing has as much information as we can give them. What, from your guys' perspective, would make it easier, or what would you like the athletic trainer to do to help with that referral process for you guys?
think pictures are
Yeah,
invaluable.
definitely. I was going to
So
say the
whatever
same thing.
pictures
Yeah,
you can
take
send,
photos.
I don't think it's very difficult to explain anything
Yeah.
accurately if you aren't a dentist.
I'll tell a story really quick if we have time. It's pretty
yeah.
fast. But just recently we had a trainer call us. It was around, I think, 10 or so at night. I was just about to fall asleep. And that's usually when it happens, I think. But no, she called and she was very flustered, rightfully so. She said, her tooth got knocked out. She can't find it. And I'm like, you really need to find it? I'm like, you need to look, try and find it, please. And so I was, kind of preparing for the worst, having a tooth knocked out, and you can't do too much, honestly, if you don't have it. I mean, you're looking at implant bridge or something to restore it. But anyways, I was like, let's just, go up to the office, see. We went up there that night, and luckily she only chipped her tooth. So she still had the tooth in there, but it's hard. You don't know what's going on, especially if you're in the moment, or if in a game, like with adrenaline or, something like that. It can be hard to we understand that. I mean, for us, it's, you look at it and you're like, oh, your tooth's still there. It's obvious. But if it's in your mouth, it can be complicated. So I think, as Reagan said, taking pictures is super important, and texting those to your dentist. And that goes back to having the cell phone number of a dentist. So, but yeah, I think that's the photos. What else? I mean, as far as the athletic trainers communicating, that would be the biggest thing. Is
the
just
biggest
photos.
thing is photos. I think the backstory is nice to know, but not really very important.
Yeah, definitely. Like how it
the
happened.
timing is
and-
important.
Yeah, timing is good. Keeping track of what time. It's like, say
When it
tooth
happens.
gets knocked out on the field, try and get a rough idea of the time. We just need to know, has it been 30 minutes? Has it been 2 hours? You know what I mean? It may not be too big of a difference, but it does make a big difference depending on the injury or the trauma. So
We don't usually need any past dental records.
Okay.
Sometimes we can request it, but it's not really very important usually.
yeah.
Okay, awesome. You guys touched on a little bit about the PPE process. And again, it's the same thing with physicians, right? We try and get the physicians in there, let's get a process going. How can a team dentist be utilized for PPEs?
So that would be for personal protective equipment.
No,
Is that- sorry.
Participation
yeah.
examination.
Okay, yeah, okay. I was gonna say no, it's okay. I was like, you can tell the dental and the athletic trainer difference right there. I was like PP. I was thinking PPE. I was like, I think that's
I was like, I'm not that
personal. Okay, so go through. What is PPE again? Sorry, from.
It's the pre-participation physical or examination.
Oh,
so their
PPP. I thought you were saying PPE. Okay.
Yeah.
Okay. So I think for that one, getting a dentist involved, if they can. A lot of the times, more of it would be the problem would be finding time for a new guy's schedule to be able to see everybody, because that would make everything easier if you can have them in groups and see a bulk. So that way the dentist isn't, you don't want to come up, make the trip to the training room or wherever and see one player. It can make sense to kind of group everybody together for the physicals. But it kind of just goes into communication. We've done it a few different ways where we'll have them. I think it works best if you have the players come in in groups. If you can get this goes back to having a dentist that is willing to come out there. The other option, aside from having the physicals on site, it'd be having the players come into the office when they can. That would be another way. Of course, if you're not able to get a time for to get 20 people together to do the physicals or whatever for that, they can all come into the office, and you can of course do everything we would need to do there as just a regular patient to try and tackle stuff that might become an issue during the season. But if you're doing it during your actual physicals where you have other stuff done, when we do it the Texans and things, they have a lot of other stuff going on. The dental is just a very small part of what they're going, which is good because they get all that kind of out of the way. But I think what we like to do for that is we talked a little bit about it in the presentation, but the visual exam, you're very limited, but we have our loops, which are the magnifying glass thing that helps a lot. We wouldn't really do anything without those, and light, because the mouth can be a pretty dark place. So we do the visual exam with the mirror and all that, check soft tissues, tongue, and all that, just kind of an oral cancer screening as well.
Okay.
There's kind of a quick little run through that we do, but we look for big cavities and wisdom teeth, things like that. Anything that can become problematic. And then that's pretty fast though. We usually can do that, it just takes a minute or so. Especially if you have a lot of people, then you got to be able to be efficient about it and quick. And then we'll also do get what we need for the mouthpieces, whether we scan digitally. You can also, that's also when you would get the impressions for the mouthpieces to be made. I don't know if I think I may have gotten off track a little bit from the question, but
Well, yeah. What was the actual question? Because we
sorry.
got caught up on the PPP acronym.
No,
Yeah.
I thought that was perfect.
Okay.
But essentially,
Oh no, he did agree. I just meant I was going to say something, but I didn't know what you were actually asking.
how a dentist can be utilized for the pre-participation exam.
Oh yeah.
okay. Yeah, I think just having them there along whenever you're doing all that other stuff. So.
And I find that, like, you know, you only see your dentist, if you're lucky, really every 6 months. And everyone has these dental questions that they don't know who to ask. And you can always look to Google, but that's not very helpful. So whenever we see people, they just ask us random questions. So it's good to have a dentist just to meet the players. They can get any questions out if they're worried about, you know, something else going on, and put a face to, you know, who's making the mouthpiece, and give them a card. They'll actually know who to reach out to. You know, even if it's a year later, they'll say, oh, hey, you know, coach, who was that random guy who came and took my impression? And then that's a great way to just get them connected.
Yeah, and ideally we want to kind of, at the local level, it's a little easier if you have, you know, the higher up you go, a lot of the athletes may live farther away or not even in the same city, so it can be a little tricky. But we really want to stress, like, establishing a dental home where you're getting checkups. I think we see a lot, especially like the college level, where you know, the athlete's probably moving to a city that that they don't have anybody, or they don't know anybody. The last thing they're thinking about is like who their dentist is going to be. But during that time, 4 years of college or something, a lot can happen. So that's when we'll see a lot of cavities, and it's so much easier to tackle them when they're smaller. But I think having a dentist come to those physicals and exams, or at least giving them a card or something to show, like, where, because if you're going in every 6 months, you're not going to have issues ideally pop up unless it's trauma, which is kind of you can't really prevent that unless you're having a mouthpiece. But like, you can get a lot of the preventable stuff out of the way if they're coming in every 6 months for their checkups, and trying to establish a dentist that if they don't have one, because I mean, you know, and that kind of comes back to having the trainer can be a big influence on the player, the kid's life, basically trying to get, because their parents may not, you know, not know about it or not know of one, or think about it. And so a lot of kids have never been to the dentist, even, like, you know, to college. So that can be a really life-changing thing, I think, if you can get a dentist involved, especially as early, or during the PPEs. Is that right?
PPEs.
I'm still getting it.
Randy,
A lot of P's.
Do you mind if I kind of hijack it for a minute? I know you're hosting. All right, so one of the things that they do on their podcast is story time. And, you know, we kind of talked about a little bit of stories. So I would like for you guys to share a couple of stories. I'll start off with one. I had a kid playing with a BB gun pistol this year, and he fired it, like, right in front of his face. So that when the slide came back, it broke his tooth. And so then he couldn't play for, like, the rest of the year, because, you know, he had to have his tooth glued back together, things like that. And so, you know, it happened at home and that kind of thing, whatever. But just fun stories, weird stories, strange stories that you guys have had dealing with teeth, with, you know, specifically athletes. And, you know, like you said, the one with athletic trainer chipped her tooth. But
man, I threw
some
that one away.
stories.
I should have saved that one for story time.
That one's funny because it was a dog. So
Oh, yeah, it
she
was a dog,
with
the hyper dog.
sports team, and you would have thought it would have been during something, you know, with the team. But she was at a
was
social
at a team
event, and
event,
a
social
dog
team
jumped
event.
up and hit her mouth. Happens a lot with kids too, where you're over a kid and they'll spontaneously jump, and then you're just like stuck with a broken tooth.
So unlucky.
Yeah, I'm trying to think.
You know, I
Go
was
ahead,
thinking this earlier when you were asking about how to find a dentist who like specializes in trauma, and any pediatric dentist could tell you a million stories about crazy things that kids have done, because it's always something just like cringy. You know, you're like, oh, what were you doing? Or just like totally out of nowhere. I'm trying to think. We haven't had any, because they're usually with kids. What was the age of your BB gun?
well, I work at a high school, so he was
in high school.
grader.
Oh, he was older.
okay.
Okay, yeah. I had one a few weeks ago that was trying to open something. One was there was two. One was a container or something, and she ripped it, and her whole veneer like popped off, and she was
that's
ridiculous.
pretty frequent.
Yeah, and then we had one that was trying to. He was mowing his lawn, and what do you call that? This thing that spins with the rope, the plastic thing.
To start the engine.
It
The
like
blade
trims.
spins on the bottom. Oh, the
trims
weed eater.
something.
that-
Yeah.
Oh, yeah.
Yeah. And he was trying to tie it, and he took his tooth and he like,
with like the wire.
yanked it, and I think the whole tooth broke off. It was like a huge. Like, I think it
With
was
weed eater string? You're
Yeah,
supposed to
a
take
lot-
concrete with that.
Yeah.
Yeah, he like took it and like did it. I was like, I cringed when he told me that. But kids have good stories. But
Yeah, I think first thing that comes to mind to me is having we saw a lot of kids at our practice we were at before we moved to Houston, but I had a little girl who came in, and her silver cap had come off, and I like walk in and kind of usually start like, what's going on? But I walked in, and like on the counter, the silver cap was sitting there, and there was like a whole Jolly Rancher like fused around the cap. So she was so sweet. Yeah, she was I'd worked with her a lot, so it was funny. I like walked in and was like, I guess I don't really need to ask what happened.
So funny.
But
No,
that's kind of the funniest thing that comes to
We
mind.
use Jolly Ranchers to remove crowns sometimes.
It's basically a Jolly Rancher.
Yeah, I mean, we use actually like it's called a ritual crown remover. But if you're in like a rural area and you don't have that,
Yeah, you could
we
use
used to
it
work
for
in a
sure.
Medicaid office. You can use a
Yeah.
Jolly Rancher. So
That's amazing.
they
Yeah.
sound good and benign, but like really they're like
Yeah.
they're truly will mess up your teeth.
I'm trying to
Same
think.
with now and laters.
Yeah.
That's good to know.
Yeah,
That's good to write
definitely.
down.
Yeah.
And well, all of our stories would really be from before when we saw all the kids. And I know
Yeah,
I saw
think kids are the
some.
ones that
I know there was one
cause most of
kid
the
who was
problems.
chasing his friends. He literally knocked his whole tooth, like avulsed the tooth. And he went to a different dentist. And this is what I was so mad at him. He went to a different dentist. They put the tooth back in, saved the tooth. I don't know. They didn't splint it. I don't know the story, but they told him just leave it, like don't touch it. And then he went back home and took the tooth out and just left it out for like I don't know how long. And then he came downstairs to see his mom. And his mom was like, "What did you do?" He was like, "It was loose. I didn't want it." So I mean, when I saw him, he was maybe 9. Like it was a new tooth. It was his permanent tooth, and his whole life he's going to have to worry about flippers or implants or.
Yeah, I
This
just
is a Medicaid office.
yesterday.
So I think they're looking at the flipper.
Yesterday, I can't remember. I was watching something. I think it was a continuing education course, but there was a story about a kid who he had his lower incisors coming in. They were barely out that 6 to 7 year old stage where they're and the roots aren't fully formed yet. You can't see them, but they take a couple of years to fully form and become normal teeth. And he was in class, and I think he was, I don't know how old you are in your 6 or 7, but I think he's maybe like 1st or 2nd grade, and he literally just pulled the whole tooth out, and the teacher was like, "What did you do?" And it was like, it's like a permanent tooth. It's a baby tooth. It's kind of like, well, good, it's fine. It happens all the time. But they went to the dentist. I think they went to the nurse, and they put it back in, and then they went to the dentist, and they had to splint it and everything. And he's doing well. The good thing is, I mean, the younger you are, you kind of have,
Really fast.
yeah, you can heal up faster and things like that. So, but that was kind of crazy. He was just messing with it and literally just pulled it out. I was like,
Yeah,
that's
kids
crazy.
really, they don't seem to feel pain the same way that adults do. Like you can
Yeah.
do a lot in a kid. I mean, of course you always numb them, but like afterwards you're like, well, like he's probably gonna be really sore afterwards. Or
Oh,
he had
gosh.
this done.
Yeah.
Yeah. And they're like running around a few hours later.
Playing
so
the
they
next
don't
day.
even, they don't even register. Yeah. Or they'll come in with like their tooth knocked out and they're just like perfectly fine. You're like, oh my God. Let's help you out.
Yeah.
But yeah, that's about it.
The last thing that I had was another thing we like at AT Corner is the action item. What can I take immediately into my practice? And you guys did a great job with the goodie bags.
Oh,
I
thank
thought
you.
that was awesome.
Yeah,
But
Reagan can get the credit for that.
what do you guys recommend that an AT should have in their kit for any dental emergencies?
Well, most of the things in the bag are really not so much like dental specific. So if you have some gloves, some gauze,
Light.
a
that's
light,
really
flash, even a phone flashlight is fine. That's going to get you a long way. The thing that's in there that I think is so like important to have that really is going to help you is the actual like guidelines on what to do if something happens. So that kind of goes back to either downloading that app, finding dentists that you can text quickly, say, hey, send them a picture, this happened, what do I do? The knowledge is hard, especially because it's so rare to have these happen. It's hard to keep that knowledge present, like, oh, tooth fracture, do this. If it's loose, do this. If it's bruised, do this. It's hard to keep that, in the front of your head. So like a cheat sheet would be great. I mean,
Yeah, I think if you're looking for like one answer, it'd be the cell phone number of a dentist.
yeah, that's great.
I
Yeah.
think-
The app is good too.
I mean, because it's nice. Because if you think, anything tooth related, it's like, let's call the dentist. Even if don't even, Philip, you're not expecting you to know like what, like, oh, he has an ammodental fracture on number 8. It's like you're not expected to know that. So I think just having that cell phone, anytime anything happens with the teeth, the gums, anything, just
The one thing that you
add the
should
number.
probably have if you're actually doing this like full time, which is the one that's not in that kit, is the Save a Tooth solution. No, it's hard because you will probably never ever use it. But if you need it, then you really need it. So that's for avulsion. I don't know how much if everyone's keeping up, but if you lose a tooth, you can either put it back in immediately, like
which is
within 15
recommended.
minutes, which is please try to do that. If you can't put it back in, because if the bone's fractured, if the patient's knocked out, if something's, they're just not letting you mess with them, then you can put it, the storage medium makes all the difference. Like life or death of the tooth is what storage medium you're putting it in. So save a tooth is the best. You have up to an hour if everything is perfect, but probably not that long for most people. You can spit into a cup. Somewhere between an hour and 15 minutes would be what that gets you. Don't put it in water.
Yeah, we've even heard
put it in
like putting the tooth in the athlete's lip, like and keeping it down there, kind of like tobacco.
I got off track. What was
Action item.
Yeah, like what?
Oh
like
yeah,
what
so that's the one thing that was actually something that really could benefit you, but it's just so rare. It's hard to have everyone keep up with it.
They're,
I think they expire.
kind of expensive too. I think they expire. I'm not. Y'all may have more experience with getting those. I'm not sure.
Having the athlete spit in a cup is a good kind of second option too.
Yeah, and that may be something the dentist could, if they, we have a bunch at least I'm not sure if every dentist does, but we have a lot of those in the office, so it could it'd be something we could.
Yeah, if a dentist,
throw to the
the
trainers
dentist,
and
they
let
might
keep
be
it.
able to hook you up with a.
Yeah, and it's one of those things you don't really need at the office because if they're at the office,
You're-
you're like you can do
We're
it.
not
Yeah,
storing it.
yeah. So it's one of those things that doesn't do much good at the office. So it's better in the hands of a trainer or somebody.
I think that's it. We have some like benzocaine in there, but that's really not that important.
Okay.
Yeah. I mean, it's nice to have, but it's just for comfort.
Awesome. Thank you guys.
No, thanks for having us. This is awesome.
All right, so Doctors Hiner, if
Is that
I think that's what we've agreed
I like
on.
it.
Doctors
I like
Hiner, if someone wants to get a hold of you, what's going to be the best way to do that?
or text?
Yeah, call or text. We have, I don't know if you'll have access to it, but our office information, Hiner Family Dentistry, you can of course Google that on Google Maps. We're right inside the loop in Houston, so anywhere. But like I said, you want to have somebody that's close by. So if you're out of state or something, you can call us. We'll try and help you out the best we can. But you'll want to have somebody closer. But anywhere, anyone in the Houston area, we'd be happy to at least point you in the right direction or take care of you if we can do that directly. But our office number is 713-667-6478. Anything else? But
And then if they reach out, we can always meet or talk about if you actually want to,
yeah,
need to meet up.
yeah, definitely.
Very good. Obviously, you can get a hold of Randy and Sandy on the AT Corner podcast on Instagram, which they're still not on Twitter, right? Nope. I don't understand why you're not on Twitter. Right? All right. And then me, Mr. Jeremy Jackson, on most of social medias. Again, this is sportsmedicinebroadcast.com/dental issues. Again, sportsmedicinebroadcast.com/dental issues, live at the 2023 Memorial Hermann Sports Medicine Update. And that is a wrap.
I think one big takeaway from having the conversation with Doctors Hiner was just how much your team dentists, they just want to help. They whatever they can do to try and make your life easier, help get the best outcome for the student athlete or patient. They're happy to be a part of the team.
Right. And it's like they said, it's not like you're going to need them every single day, but when you do need them, you really do need them.
Yeah, that's so true. It's hey, we got something.
So if you want to find their contact information, we'll put it down in the show notes below. Again, thank you so much to Sports Medicine Broadcast for helping us get out to the Sports Medicine Update and kind of getting us on board to co-host some of those podcasts there. So you'll be hearing a couple more from us, as well as if you want to check out some of the other podcasts as well that we did there and that Jeremy Jackson did there and some of the other co-hosts that he invited.
Yep.
You can go to the Sports Medicine Broadcast, which you can find pretty much anywhere. Also linked down in the show notes, which is also a place where you can find pretty much anywhere all of our main stuff. So if you're new, we do every other episode as education or stories. This one was an education episode. Next week, we're going back to our story episode where we take experience from real life athletic trainers and we kind of just go over a certain topic and share your stories and what it's like to really be in this profession. And lastly, we do have a code for MedBridge since it is a reporting year. You can use code ATCorner for $150 off of your subscription. And because you're getting it at the end of this reporting year, you can also use those that you take for next reporting year.
Yeah,
So-
the subscription is for a year, so
So-
you get 2 reporting periods.
Exactly. So, without further ado, do you have anything else?
Nope, that's perfect. Thank you for helping us showcase athletic training behind the tape. Bye.